Actually,
Thanks.
we were going to let everyone know that we are presenting, or I'm sorry, we are recording this meeting and all future meetings. You know, just to let you all know, and then we're going to meet on a quarterly basis, just to let you all know. Yes, Michelle is up next.
Even quarterly during open enrollment?
Yes, we will try to host that as post open or middle of open enrollment meeting.
I'm going to suggest we put that off until February.
Sure, we can do that. We can engage the rest of the group as well on that, but thank you, John, for that suggestion. All right, so we have a message from our executive director, Michelle Everly. Michelle, I know you're dialed in.
Yes, I am. Thank you, Mimi, and welcome everyone to this first meeting. I'm sorry that I'm not there in person, and I'm well, we're all virtual, I guess. I'm sorry I'm not on the screen, but I am up in Boston at the National Academy of State Health Policy. I've had some really good conversations about health policy and a lot of discussions about our brokers and our broker community and how valuable it is for the work we do. And I want to thank you all for the commitment of your time that you are giving to this group, and let you know that you really are critical to our efforts to get all folks insured, and especially during this public health emergency, unwinding and trying to make sure that no one loses coverage and we get them to, whether it's employer-sponsored coverage, small business coverage, and through the marketplace, staying on Medicaid. The whole goal of the nation is to make sure that people that are eligible for health coverage can have health coverage or remain health coverage. So I applaud your efforts, and I want you to know how very important you are to the exchange, and that we very appreciate your efforts, and I'm looking forward to the work that will come out of this group. So thank you.
Thank you, Michelle. I didn't want to interrupt you, but your voice was very muffled. It was difficult to hear.
That's exactly what I'm experiencing too. I'm having a really hard time hearing anything.
Oh, wow, we can hear you fine, Rita. It was just Michelle's message that came in a little difficult to hear, but we can continue, and hopefully we won't experience that issue anymore. If you would like to restart your computer, if you're having audio issues, you're welcome to do that.
Mimi, is this any better?
Oh, yes. Now you're much better than me. Right?
Okay. Well, then let me just reiterate real quickly again. Thank you. What I wanted to convey is that I've been at a conference in Boston, and we're talking about health policy, and we're with our Medicaid partners and our state-based marketplaces, and we've all been talking about how important our producer community is. And in Maryland, we're so proud of the work we've done collaboratively. We're so appreciative of the work that you do each day to help us get people health insurance, and especially in this time with the Medicaid public health emergency unwinding, everyone across the nation is looking at how are we going to make sure that people that are eligible for health coverage will be able to get health coverage, whether it's through employer-sponsored coverage, the marketplace, continuing in Medicaid or through Medicare, and you all play a very important role in that. I'm really excited to see what comes out of this advisory group and how you can help us shape the future path for the work we do. So thank you for your commitment of time and for your participation. And sorry I'm not on the screen today, but want you to know how much you are valued by the exchange. Thank you.
That was loud and clear. Thank you, Michelle. So we can move on. I know Rita's having some audio issues, so I can just go ahead and handle this part. So we're gonna do some introductions. State your name, provide us with a brief introduction of yourself and your services. I'll start. My name is Mimi Hyla-Gabriel. I'm a small business program manager at MHBE. I started last year around this time, and I'm excited to be here. Excited for this group being held together. I used to be also a broker in the past and worked at some of the healthcare, health insurance companies. So welcome to you all. And we can go ahead and start with Chris if he's on. Oh, Sophie. I think Sophie, you're doing introductions for him, right?
Hi, yes, my name's Sophie Keane. I'm with Keane Insurance Associates, brokerage on the Eastern Shore in Ocean City, Maryland. I'm actually doing this meeting on behalf of Chris Keane. He unfortunately couldn't make it today. Chris Keane has been a licensed producer for 29 years and established Keane Insurance about 18 years ago. I'm the manager here. And we service small, large group and individuals. Yeah, that's it.
All right. We're following the order. So John, you're next.
Okay. My name is John Levine. I'm an agent by myself. My DBA is Viking Benefits. I've been working with Maryland Health Connection since its launch. I've been licensed for about 11 years now. That's pretty much it. I know a lot of you already, and I enjoy working with the team at Maryland Health Connection, and excited about open enrollment, but I don't really want it to happen so quickly. I'm enjoying the summer.
Great, thank you. Not to mention you're one of our top three top broker here, so for 2023. So yes. Next is Herbert.
Hi, everybody. My name's Herbert Baumgarten. I've been doing insurance since 2017. I do individual and group insurance. I live in Baltimore, so most of my clients are in Maryland. I am licensed in about 20 other states, and I'm also excited to be here.
Welcome, thank you. Ted?
Yes, hi, good afternoon, everyone. I've been a licensed agent in Maryland for over 25 years. I've been working in the health insurance marketplace for over 15, and with the health exchange since inception. I participated in the BAT phone program numerous times, and I've got over 1,000 client enrollments, and looking forward to continuing my relationship with the exchange. Thank you.
Thank you, Ted, and welcome. And we have, is Amber on the call? Okay. I didn't see her join us earlier. So is Mark on the call? Mark Katib.
Yes, hello. Good afternoon, everyone. Mark Katib here. Been in the business about 35 years, representing Employee Benefits Corporation of America. I had a lot of experience working with the individual brokers, TPA, general agents, third-party administrators, you name it, we do it. Very excited to be very honored to be part of many organizations like yourself, broker councils, nonprofits, and I look forward to participating as the year moves forward. Thank you.
Thanks, Mark. Brandy, I believe Rita said he's not going to be joining us. Wande?
Hi, everybody. My name is Wande Desali. I'm the owner and principal of Spring Financial Services in Silver Spring, Maryland. I have been working with the exchange since 2014-15, licensed in a couple of states, about 7-8 states, and I am excited for being part of this advisory committee. Thank you so much for Maryland Health Connection, the leadership for including us, incorporating us as part of the decision-making process. Looking forward to work with you guys. I appreciate it. Thank you so much.
Thanks, Wande. Gregory?
Hi, good afternoon, everyone. Greg Dunlap. I'm a general agent and owner of Dunlap Financial Services. We do auto, home, business, life, health, on exchange, off exchange, and shop. I've been with Maryland Health Connection since 2019, started in 2008, and became an agency in 2020, registered in Maryland.
Thank you, Greg. Welcome. Sandy Walters. Sandy, I don't know if you're speaking, but you have to unmute yourself. Okay. We can come back to him because I'm sure I've seen him in here. Eugene. Eugene?
Hi, this is Sandy Walters.
Oh.
This is Sandy Walters. I've been an agent for over 40 years. I've been involved with the exchange from before it started on through now, on committees and all parts of it from the beginning. Work at Kelly Benefits, and we're a TPA, and we're also a broker servicing these clients directly as well as indirectly through our brokers.
Okay, can you hear me?
Yes.
Okay, Gene Poole. I've been involved with health insurance for about 43 years. I'm retired broker sales manager from Care First, and I formed my agency back about 7 years ago. Pretty much involved with the health exchange since its inception, and I'm licensed in 20 states as well. I specialize in individual and small group, and I'm honored to work with you guys and be on the committee.
Thank you, Eugene. Welcome. And Jennifer?
Hi, everyone. I'm really excited to be here, and I'm honored to be a part of such an esteemed group with so much experience. I have been in the business for 30 years, and I recently joined Insurance Marketing Center. So I'm very happy to be here representing IMC, a general agency located here in Rockville, Maryland.
Thank you, Jennifer. Welcome. Sally? Okay. I thought Sally was fine, but let's go to Carl.
I think Sally's on mute.
Oh, okay. Let's see.
Hi, guys. Can you hear me now? Sorry, had a technical difficulty.
Yes, we can.
I'm so sorry about that. So Sally Turnbull, Health Quote Insurance Services, a small agency out of Jarrettsville, Maryland, handling the whole state of Maryland, been in insurance for over 32 years. Most recently, the last 25 in health insurance. So we do health for under 65, over 65 clients. Been with the Maryland Health Connection since the inception, was kindly asked to help out when they were doing the specs for the system generation, which was really appreciated, and happy to be a part of the group. Thanks for having me.
Thank you, Sally. Last but not least, Carl.
Hello, everyone. My name is Carl Williams with Insurity Brokerage Firm located in Bowie, Maryland. Been in insurance going on 23 years. Deal with the individual and the group side. And we also deal with back office issues regarding groups as well, regarding payroll and benefits administration as well. And I cannot believe that I was selected to be amongst this wonderful group. So thank you very much. And I look forward to see what's going on. Thank you.
Thank you, Carl. Welcome. Glad to have all of you here. So last Friday, a charter was circulated amongst the group to review and approve. Hopefully we can approve it today, but also as part of the charter, we have drafted in there that we will elect 2 co-chairs. I have received 2 people who are interested in this position. And so the elected co-chairs term will last the duration of the committee term. And in addition to presiding at meetings, co-chairs will take an active role in determining the recommendations from the general body, and they will preside over the vote counting for recommendations, and they will work with MHBE staff, that would be me and Rita, to determine action items required of MHBE support resources. And typically we'll meet a couple of days in advance or a week or so in advance of any upcoming meeting to work out any upcoming presentation and what we will be discussing at the next meeting. And so the 2 folks that I know are interested in the position are Carl Williams and Eugene Poole. Are there any other interested parties who want to throw their hat in the mix?
I'll throw my hat up next.
I'm sorry, who was that?
Herbert.
Herbert, okay. So we have Herbert, Eugene, and Carl. So what we can do is I can issue a poll through the meetings. It's that activities tab or icon in the bottom right of your screen. It's 1, 2, 3, the 4th one down on the icons list, and it says activities. There's a triangle, square, and circle. And so when you click on that, the poll will come up to vote for someone. So just give me.
Well, you just muted yourself, Mimi.
I know I'm just working on, I had the poll set up earlier, but I am just pulling it in quickly right now. Yeah.
While you're getting the poll together, Mimi, I know that Tamara has joined. I just want to give her the opportunity to introduce herself as well. And I think I heard Johanna.
Yes. Do you both want to introduce yourselves? There are directors and within the leadership team.
I'll let you go first, Johanna. Okay. Hello, everyone. I'm Johanna Fabian Marks, Director of Policy and Plan Management at the Exchange. Here to support Mimi and Rita, and I'm excited that we're getting this forum established and up and running, and very appreciative of all of your interest in participating.
Hello, everyone. My name is Tamara Gonchar. I'm the Director of Consumer Assistance. I've been with State Services for 31 years, and I've been with Exchange since it started. And very happy to meet all of you. You're doing great work. Thank you.
Thank you both for your introductions. Let's see, I am about to launch the first poll. So it's just going to say vote for 2 co-chairs out of the 3 that have been expressed interest. It's Herbert, Eugene, and Carl. So I'm going to launch that, and you'll see it at the bottom of your screen. You may have to hit that activities icon, and then the poll should come up. So you'll be able to vote now.
Nothing has come up yet on my screen.
Looks like you can only choose one.
Okay, so we will.
Mimi, we can send out a poll after the meeting as well. I think that'll be a little easier.
Yeah, I thought you could choose more than one item in this, but I guess you cannot. So yeah, what we can do is we could just pick the top two with the highest votes.
Why don't we just take care of it after the meeting so folks have the opportunity to vote for two?
Sure.
I vote for, but I don't have a button to hit.
Okay.
We'll send out a survey monkey or something like that after the meeting. That'll be easy for folks to vote on. So you don't need to worry about that now, but we've got the kind of options and we'll get that out after the meeting.
We were also planning to use this for to approve the charter.
Well, that should be a yes or no vote, so that should be easy. But we could also send that out after the meeting too, and just take care of all of the voting afterwards.
Okay. That's a good plan. Thank you, Johanna. So we can move on from this, but I do agree with John that if the folks who are interested, if you don't mind just submitting like a brief, a resume or, I'm sorry, was someone speaking? I was saying just submit something about yourself that, why you should be elected for that position. I think John suggested a resume or something, which will be, I think if that's doable for you, that would be good. So
maybe just one note before we move on from the charter, although we'll ask people to vote on it after the meeting. If anyone had any feedback or discussion on it, we could hear any comments on that now.
You're talking about the charter document.
Yeah, the charter. Yeah.
Okay.
Yeah. It's a pretty straightforward document, so it sounds like no one has concerns.
Yes.
The one thing I'd say, you already have everybody's resume with their application.
Right. So is everyone who is interested in the position okay with me sharing that document with the rest of the group?
I'm okay.
Okay.
I'm fine with that.
I'm fine with it too.
Perfect. That makes it easier for everyone then. All right. So with that said, I will pass it to Rita for an update on and information for MHC individuals.
All right. Hopefully my audio is fine, and I hope you can all hear me clearly. Can I get the next slide, maybe, please?
We can hear you, Rita.
Perfect. Okay. So of course, just like the rest of you, we're preparing for open enrollment. We do have some, a lot of planning underway, and I have some dates that I was going to present today as well. We are still in development mode for backbone for the upcoming year, determining which way we're going to take it. Hopefully we'll be in line with our normal timeframe for issuing the RFA. It should be late August, early September. We have a couple of meetings and some supplementary training sessions planned for this upcoming fall. We have a session that we're going to hold on September 13th, how to correctly enter income on MHC.gov. Our annual brokers operations meeting will be October 18th. And then we're also planning a live broker portal walkthrough session. I don't think that anybody here needs the supplementary training, but what we found in the last year particularly was a lot of brokers, brand new brokers entering the marketplace, as in not just brand new to MHC, brand new in general. So we wanted to touch base with some additional training, particularly as it relates to income entry, because that's one of the things that causes a lot of escalated cases or misunderstandings. And then we have made a lot of changes in the broker portal over the last year. I'm sure you are all aware. So we're planning to do a live walkthrough too. I don't know that everybody is using the broker portal to its, maximum advantage. We will have a new carrier entering the marketplace. You may have heard that through the grapevine. More information, of course, will follow. And when I crafted these slides, I indicated that annual training was to be released soon. I'm sure you all know that it was released last week, and I bet you all have done it. But, as always, annual training is an annual requirement and must be completed before open enrollment. Next slide, please. And then I'm just going to run over the system changes that we've made to enhance the broker experience over the last year or so. At the end of July, we implemented Broker Portal and the MHC mobile app. We have not widely released this information. We have a training guide that is nearly completed, so we're planning to send that out and also release it widely. I know some of you were involved in testing and were given advance notification, but widely we have not released that. Brokers can now customize the notifications in their broker portal. That was a huge ask. We implemented the ability to search by person ID in broker portal. Brokers can now see the suffix for household members in broker portal and notices. I believe that was a request from John Levine. Brokers can now upload documents in the commission escalation path. You have access now to view the case comments, which will be extremely helpful with seeing where a case is in terms of the escalated cases process or where a verification document is. And then we added filters to the broker listing on mhc.gov to allow a consumer to search for a particular broker based upon their needs. And I think that's it for me, Mimi. Does anybody have any questions?
I had a question about the mobile app.
Yeah.
So, you know how we have the identifier with the specific laptop that you have? When you have this broker app, does it allow the broker to use both the app and his laptop, or can only use one device still?
You mean simultaneously? Or you mean
No, one
in
or the
general?
other. One or the other.
Yeah, you should be able to use both interchangeably. You're still going to get the MFA text or email if you're accessing your broker portal on the broker app. So you'll still get the text or the email for the multi-factor authentication, but you should be able to use both.
So you don't have this issue where, you know, we would tie it to one laptop before with the laptop ID itself, you know?
Well, I think I know that was an issue with that phone particularly. I wasn't aware that there was any issue that existed with your specific laptop.
No, I didn't have an issue with my laptop. What I meant was that I thought that we could only use one form factor, either a laptop or a handheld, not both.
Right. I gotcha. I don't think that this will be an issue. Let
Okay.
me know, of course, otherwise when we roll it out widely.
Okay.
Or play around. I mean, it's live. If you have the app on your phone,
I downloaded
play
it.
around.
Yep, I will.
Yep.
Thanks.
Alrighty. Oh, I just got a little nudge from my boss to let everybody know that in addition to the training sessions, the supplementary training sessions, and of course, after open enrollment, we will begin quarterly meetings for brokers, a more wide forum.
All right. Sounds good. Any other comments for Rita? Any other feedback about MHC for individuals? Because we're about to move on to small business. Okay. Well, over the next several minutes, we will be talking about the small business programs and how we're going to enhance it. We recently have been meeting with our IT team to gather some requirements for an enrollment portal. And so most of this presentation is going to be focused around your feedback on how our policy for small business and then the system functions or the functionality and features of the system. So happy to, I know some of this will be some new topics for some of you, but, we can, you're welcome to stick around and provide your feedback, even if you're not, a small business broker. So for the 2024 and 2025 small business programs, we've got some exciting things lined up. And one of our key programs, like I mentioned earlier, is the enrollment portal. And we've received numerous feedback from our small businesses that are trying to enroll in our system, as well as brokers like yourselves who were frustrated with the enrollment process and that it was too complicated and inefficient. So about 4 months ago, we started working on this full service one-stop shop enrollment portal, and it's exclusively for our small businesses. And so we're gonna need your feedback on that today. But the second program is our outreach and education program, along with a preferred broker program. And a lot of you might be already very familiar with this. We've spent about a year developing this and working on it with our small business advisory committee. And so for the preferred broker program, we were able to host an award ceremony back in May, where our executive director, Michelle, you just heard from, hosted that, and we selected the top 3 brokers for 2023 based on enrollment in different areas and different market segments. And actually all top 3 are here today in this group. So that's great, right? And most of you also are in the top 10, I believe. And so, you know, congratulations to you all. And through our efforts to collaborate with the Maryland Insurance Commission, we're going to develop an enhanced training program to offer continuing education credits for the top 100 brokers that made that list for 2023. And so that's in the works. And also the top 3 got a recognition award and a proclamation from the governor's office. So that's another thing to celebrate, I think. And so our second annual Broker Achievement Award is set to be an in-person event. The last event was virtual. So our planning committee is going to meet next month, early next month, to begin the planning process for that. And then the outreach and education program aims to respond to the small business and nonprofit health insurance subsidy work group that met back in the summer of 2022, which unfortunately they chose not to recommend to provide direct subsidies to small employers, but suggested allocating $2 to $4 million for an education program and incentives to employers who host educational opportunities for their employees. And so while we were not able to secure funding for that through the legislature, we are still working to establish the program and hopeful to get funding for fiscal year 2025 for that program. And then lastly, we've received responses from an RFI we issued for an ICRA administrator partner. And we plan to issue an RFP at some point down the line to select an ICRA administrator partner. And this administrator would be able to train and work with producer or brokers and advice and assist employers in setting up an ICRA plan, which will allow employees to connect with less expensive plans on the individual marketplace. And then they'll manage compliance documents, determine contribution levels on MHC for small business, and then assist employees with signing up for an individual plan using the HRA fund set up by their employer. So that's just a quick overview of the actual programs that we have lined up. And I'll pause right here before I go on to the next slide to kind of gauge your feedback and any comments about this. All right, we can move on then. So to provide you with a
Sorry, I just had a small comment. Sorry.
That's okay. Go
No,
ahead.
just for the ICRA administration, I don't know if this plays a role, but I could just say that a bunch of administrators give brokers a referral fee or some sort of commission when we use them to set up an ICRA. So I was just wondering if like your exclusively having brokers use a certain ICHRA administrator, or if there's a way that brokers can still be compensated even when you work with a certain administrator. That's all.
That's a very good comment. I'm gonna make a note of that. And but we can circle back to that. That's a great point. So to provide you with a quick overview of our current system, basically we provide small businesses with information on benefits of enrolling on exchange, which includes employee choice and employer choice, the small business health insurance tax credit, and then groups use our paper and employer and employee forms to provide their eligibility and provide their eligibility letter to the carrier of their choice. So also brokers can choose to work with the TPA or general agent of their choice to help with the administration and the implementation part of getting the group through to the carrier. And so we still have heard, some dissatisfaction from the small business and broker community with that enrollment functionality not being available, because once they get on our website, they get all the information, they get the forms, and then they're like, wait, how do I submit this? And how does the process work? So we are trying to simplify that process in short. And so we've spoken to DC HealthLink to understand how their system works, because they've had that system for many years. And as you probably have also experienced that system as a broker, and they've had a lot of success with it and running their program. They've also helped Massachusetts with implementing a similar system. So but we looked at what resources we have, and while we're using information from DC HealthLink and they're helping us with, how they've developed their system, we're using our internal IT system, our IT staff to build our own enrollment platform. So this enrollment functionality timeline just kind of gives you an idea of what amount of time we're spending and what the launch date looks like. It looks like we're looking at a May 2025 launch date. We're spending about 3 to 4 months in each development area, requirements and design and testing and integration with the billing vendor that we're going to cover down a few slides down. Any questions about the timeline? All right.
Will we have the input with the builder of the application?
The builder of the enrollment platform, or the TPA?
Either, because in software development, when they're doing these things, often the people who are doing the development don't really understand the healthcare industry at all, and so if broker's not involved with that.
Right. So this is the medium. I'm the bridge, right? I'm gonna take your recommendations and take it back to our IT staff, and we're collecting. This is the form that we're going to use to take any recommendations you have, and down the line you will be, hopefully we'll have a testing phase. Well, we will have a testing phase with the carriers and the TPA, but hopefully we'll also have something like that with the broker community, and hopefully with some of you here, especially. So yes, we plan to make sure that you stay engaged with this as we build it.
And one of the follow-up has to do with the carriers themselves. When the carriers are dealing with ACA products, there seems to be, they want us to sell the non-ACA programs, but when you try to follow with them on the ACA programs, especially group, they have difficulty in keeping track of it, what division of the organization covers it. It doesn't seem to be the same high level of commitment to the ACA products and services as it is to the non-ACA products and services. I don't know if anyone else has experienced that, but I have. And when I try to talk to the carrier about certain things, they can't find it. They don't know where it is. They don't know who's running it. You know, the commitment doesn't seem to be as strong as I think it should be.
I mean, that's a great feedback. I think I've definitely also have experienced brokers being frustrated with that. But I think when we simplify the process, when we take control back of the process, because right now we rely heavily on the carriers to, take the entire process and make sure that the groups are using our forms, but they're doing basically most of the work as far as getting that group in. And but what we're doing with this system is going to help take back the process, and that should ease up a lot of that, I guess, the tension that you're seeing, or the inefficiency that you're seeing.
Yeah, now they seem to jump through the hoops when it talks about the individual market. They'll say, "Oh, MHC did that," and yes, we have to wait for them to tell us, kind of thing. But on the group side, they're not quite there.
Yeah, I think they will get there soon enough.
Good. Okay.
Yes. And so this is just the flow chart of how our system will work. So the employer, employee, and broker are the main users of the portal, and these users will be able to create an account, submit applications, determine eligibility for enrollment, select plans, benefit packages, and be able to renew their plan as well. And we will secure a third-party administrator for the billing and aggregation services, who will issue an invoice to the group, collect their payment, and distribute it to the respective carrier or carriers. Then the enrollment will be sent to the health insurance carriers for effectuation. And so the carriers have been working with us on this, and have told us, there's certain timelines they need to keep, because they need to receive the enrollment file and conduct reconciliation between the billing and enrollment. And so we need to ensure a smooth process for that. Right. And so the account creation, are the users are not just limited to those three that I talked about, although they're the top three that we will probably have high usage or high activity from. But there will really be 7 types of accounts, and that's the employer, broker, employee, the employer admin. Will also have an MHBE admin, and then there will also be a super user admin from our staff, and then TPAs and GAs will also have their own login. And then do you all see, hopefully you've had a chance to review this in advance, and so do you have any suggestions as far as accessibility? What if we need to provide brokers or employers or admins any specific usage that we didn't already address here?
I had a question about getting quotes. In your quote system, will there be, right now when we do a quote, be it any of the other organizations, we're able to show side by side the quotes for all the carriers in one, and when we send it out to them, we send it out in one format so they can have, say, Blue Cross and Kaiser and side by side comparisons and all. And as you know, there are a lot of companies that do that today. So my question is, are you guys going to reinvent the wheel and start fresh, or are you going to use one of the current organizations that do the quoting for the brokers today?
Well, our system allows you to quote amongst and compare up to, I think you can do up to 5 or 6 plans, and you can compare amongst different carriers. So that functionality, we don't believe, we're not going to touch that, or we're not going to change that. I think it's sufficient. It's worked for me in the past, but was there a suggestion?
Well, some companies, what they do is when we're doing a quote, they'll have a spreadsheet, and it'll be an Excel spreadsheet. It'll have 30 different options, not 5 or 6. It'll have 30 of them. And then you can pick and slice and dice any way you want to see it. You know, it's an Excel spreadsheet type presentation, but it allows the broker to slice and dice because it is an Excel format where you can slice and dice it very easily.
Okay, we'll make a note of that and see if we can provide something like that.
I'm not trying to mention any names. That's why I'm trying to be careful here.
That's all right. No, this is good feedback. This is exactly what we wanted, is feedback. So, Ted, did you have a question?
Yes, hi, Mimi. So I just want to make sure I'm clear. So you're saying that the end state of this whole process, when the new platform rolls out, will it be an extension of the current MHBE platform, or will it be a standalone platform? And then also all of these different inputs that you have listed here. So these will all be functional inputs on the new platform. Is that what the expectation is?
Yeah, so we already have a small business website. MHC for Small Biz is its own website, but we're going to add an enrollment feature to that existing platform. So right now you can, run a quote, and employers and brokers can log in and see their groups, quote for the group, but the enrollment feature is not there. So basically we're just adding an enrollment feature to the existing system. And all of these folks will have, all of these users will have their own logins to view, an extensive data, extensive information on the employer dashboard, or very limited. The TPAs and GAs, as you can see, will only be able to view the group's invoice and download an enrollment file, and that's it. Did that answer that question for you, Ted?
Yes, it does. One other question, if I could. So not all TPAs participate in the small group health exchange program. So I guess the platform will make you aware of what TPAs participate in that program.
Correct. That's true. So any TPA that wants to work with us will be available in that system for you.
Okay. Thank you.
Sure. And Johanna just shared our current website, MHC for Small Biz, in the chat. So if you have access to the chat, you can quickly go ahead and look at it, or save it and look at it later. Yeah.
I have one other follow-up question.
Yes.
So the individual market and the small business market, if the employee puts in their information and their social security number like they do in DG Health, let's say they leave the employer, there'll be a switch that will allow them to apply for the individual market should they leave the group market without having to reinvent the wheel and put all the information again. Can they just simply say, now I want to apply for the individual health coverage because I've lost my coverage with my employer, so they don't have to reinvent the wheel?
Okay, so you touched on 2 points that I want to address. The first is we're not collecting social security numbers for the purpose of submitting that file back to the carrier or any of that. We're going to verify that employee by name and date of birth. Once the employer provides sort of like a census in the account and says, this is my employee, this is their date of birth, and then it will trigger that employee to go in and create their account and verify that information to be linked with that employer. The second thing that you asked about was to link the employee back to the individual market once they leave their employer. Yes, right. That's been discussed extensively amongst us, and especially in the case of COBRA, where COBRA plans.
Yeah, exactly.
Extensive. Right. So we will have a link provided to the member to go back and to check out the cheaper plans on the individual market. You may be eligible for a subsidy. That type of information will be provided.
Okay. That'll save a lot of work.
Yes. But it's for the best.
Yes.
So
can you tell me the beginning of that answer? Because I had a question and now I forgot it. Your answer. Yeah.
Oh, the answer. You want the answer, or you want the question?
No, I want the answer. The beginning of the answer.
Okay.
Raised an issue. I think.
Oh, okay. So we said that the employee, we're not collecting social
Okay,
security.
I got my question.
Okay.
What happens if an employee doesn't enroll, even though the group enrolled and they didn't go online to enroll? What happens then?
If the employee does not take action, then they're counted against the participation rate and they're counted as an invalid waiver. It's basically a waiver by omission. So they will be counted against that group's participation.
Okay, thank you.
Sure. Okay, so account creation. We have a reminder from our privacy office to prioritize safeguarding the employees' PHI. And so that's why we're showing the social security numbers, as I stated earlier. And so also we would like, they want us to shield date of birth as well in certain cases. So we wanted to gauge your feedback about when we will allow, so our suggestion from our team was that the employer's admin, MHBE admin and broker can update the employer account, including the employee's name, name of business, and EIN, address, business phone number, and email, and language preference, and certain things that you see listed in this presentation here. And also they will be able to do the same with the employee's account, except for date of birth and certain PHI information. But we wanted to gauge your opinions on, when the employer and employees add or update their account and after their coverage has started, or should they be able to update their account after the coverage has started? And so that would mean it would trigger, some of these changes could trigger an SEP. And so we just wanted to get your input on this.
So Mimi, are we saying that only the employee can update the social security number and date of birth and that sort of thing?
Yes, for the PHI, yes.
Okay, so here's a problem. We have a lot of people where English is a second language or a third language. We have lots of people that have limited proficiency English, where there are many, what we call representatives that come in on the scene and make certain that they put the right information in the right box. I know that we're trying to protect PHI, but sometimes I think it can be problematic. And the enrollment, I mean, we're under the gun very much, especially when open enrollment is going to be coming up toward the end of the year, and people doing their renewals, and the people can't put in the information. It's going to be really tough on everybody trying to get that in a timely manner, when most people that help people in those situations, they'll go ahead and key it in and get it done, because you're running out of time. You just don't have enough time to get everything done. So I think that we're going to run into a severe time crunch in trying to both comply with PHI issues all at the same time. We got to find a way to make that a lot easier to do, and rather than rely on the employee, because employees, very rarely do they do anything in a timely manner at all. And we brokers have been stepping in to, get it done. Now, if we rely on them for anything like that, that's going to be a big, big challenge for us all.
How, if I may ask you as a follow-up question, how are you approaching in those situations where there's a language barrier within a group?
Yeah, well, fortunately, I happen to have representatives who speak the language, who are very fluent in the language, can explain the situation. And as you know, those representatives are able to key in that information on behalf of the person that doesn't speak the language at all. I think of people that are coming in from other countries, they don't speak the language at all. They really rely on their representatives to do it all for them, and thank God that representative has the ability to do that. But it's going to be challenging for people that don't have a representative, where the employer is trying to get it all done. The care first is going to say, oh, here's our cutoff deadline. Tires are going to say, here's our cutoff deadline. And for one reason or another, you can't get that information because the person either doesn't understand the question or they're afraid to give information. And then we're trying to comply with the law. I mean, we've got to have a smooth workaround for that so that we comply with the law while at the same time getting it done.
And what about, and I'm just thinking out loud here, what about if we were to partner with another broker that speaks the language of that consumer's preference? Would that be doable, or just for that one instance, and maybe perhaps like work out a commission sharing structure?
Well, I think that we brokers can easily do that ourselves, but it's just that when you're in a time crunch, you often can't get a hold of the person in a timely manner either, you know, whether it's another broker or someone else, because when you're at the heat of the moment, the heat of the battle, where this has to get in before midnight, you know, that's what I'm concerned with. And the other part of this is that carriers, there's a big problem at the end of the year. It's been going on for the last 40 years. The carrier employees have use or lose where they must take vacation time, else they won't get paid. And what they do, they take vacation time the last 2 weeks in December, and they don't come back until January 10th or 13th or 14th. And the effective date of the policy is January 1. And so we brokers are left holding the bag with the midnight hours trying to get this thing done. And there's nobody even at the carrier level that can push the stuff through, you know? So now this is just one more thing to add to the complication of that.
So maybe we can table that. I think we definitely hear your concerns, Eugene, and we can go back to our folks to kind of discuss possible ways to address them. I think is very valid points that you're making. So I think I've definitely jotted that down, and I know Mimi did too. And then, but also sort of looking at these account update elements and who would be authorized to update them. We're certainly interested in, do you have any concerns or suggestions related to these kind of elements that could be permitted to be updated after account creation?
Mm-hmm. Could I just piggyback just for a second before we go too far off the topic? The internal commission split structure is I think a great idea. I mean, I do more life side, and I have 10 brokers around the country that do life. And there are a lot of complications that go far beyond what we're discussing. And one person trying to handle everything is not always feasible, especially if we have to reach out to someone that speaks another language. So if I was able to, I'm turning away Spanish speaking clients all too often because I don't have the help. And I'd rather, so if we can have that internal commission split, I think it would be a better honor system to reach out to other brokers to work together.
Thank you for your feedback. I see, Ted, your hand is raised, but I just wanted to say that when I suggested that a commission, sharing structure, I was hoping that would be offline, but, we can also look into if that's possible within our system. But Ted, go ahead.
Yeah, I mean, just to address the slide here. So I don't really see any kind of adverse impact from allowing the employer or employee to update their demographic information. The only thing that I would say is that if that's built into the system, that the broker be alerted when there's a change that's being made, so that because sometimes an employee may go in and make some changes, for example, a last name change, and if you as a broker are tracking that employee's enrollment based on a certain name, and if they change their name, things like that, that it would just have an email or something go out to the broker letting them know that there's been a change in the system, to log in and check what that change is or something along those lines.
Yes, thank you for that point. We have discussed that with IT, and the broker will get a notification. And actually, we discussed the amount of notification you brokers would want to receive. If you want less notification, you can opt for less. If you want every notification possible, you can get that. Or if you want just important ones, you can get that as well. So those notifications have definitely been discussed, and that's a good point, Ted. Thank you. Okay, no other hands raised. Let's keep going. So again, the language support that we have, the top language preferences that employers and employees can select are English, Spanish, Chinese, Amharic, French, Korean, Vietnamese, Russian, and Urdu. And this is based on the most popular languages in Maryland, or of Marylanders that speak the top languages. And so if you think that we should add any additional preferences for languages, we can do that. But our call center can also accommodate up to 200 languages. So the folks that we would be adding to support this portal in the call center will have access to that translation line of up to 200 languages. So
did you guys mention Tagalog for Filipino? Tagalog for Filipino?
I don't think that's in here, but we can add that.
That's one I see a lot that I didn't see it listed.
You see that in the small business market, or is it both? Eugene, is that for both markets, or individual or small biz that you see it in?
Well, I see it in both. I see it in both because I have a lot of Filipino communities that I work with.
Okay, great. I've noted that. Can move on. So the employer setting their open enrollment timeline. The employer will be able to set an open enrollment timeline based on either a fast track or a long track. And this is kind of inspired by DC Health Link's system. And so it looks like this is what works for them. And we've seen that, well, they've seen that it takes about 45 days to enroll a group from start to finish. Also, you know, with the meetings that take place, there could be one or more meetings you have to meet with the group. So, and then the carriers will need about 18 days or no less than that for implementation and issuing ID cards. So with the fast track, it will take a minimum of 34 days. And an example of a fast track enrollment would be for a January 1st effective date, a group will begin plan shopping on November 26th, and it'll take them 1 to 7 days to select the plan, determine contributions, and then they will provide 14 days for an open enrollment so that employees can select the plan from what's offered. Then the group will have 1 day to make their binder payment. The long track can take up to 90 days. So that gives the group, the broker, and employees ample time to decide to move through the process slowly. So any comments on this? Ted?
Just a question, actually. So is the goal or the vision of this platform to allow pretty much everything be done turnkey, everything from the quote to the enrollment to the billing all through the same portal? Is that kind of the intent or the vision?
Absolutely. It's going to be the same portal for the entire process, from the quoting, from the creation of the account, the quoting, determining eligibility, to the final enrollment and payment. It's going to be all in one system.
Okay, thank you.
Yes.
Another question.
Yes.
On the first payment of premium, are you guys working on 5 business days? Or are you working on any day, like you say, like first premium payment 1 day? Is that 1 business day? You know, a Monday, or Tuesday, or Wednesday. If it happens to fall on a holiday, you know what I mean? Then what do you do? So let's say the first day is due Monday, the 1st. But the first is a holiday. You guys are closed. Everybody's closed. Now you got the second day. You know, how you kind of adjusting for those anomalies? And are you strictly dealing with business days, or are you dealing with 7 days a week?
That's a good point. We're going to take that back to IT. And it also depends, especially for the premium payment. We don't have a TPA selected yet. And so we'll have to work that out with them once they're selected as well. So, but as far as the selection of the plans and contributions, it's based on that calendar day. So it's not limited to, it's just saying generally it could take you 1 day or it could take you 7 days. It could be anywhere in between that, but it wouldn't be more than that 7 days. You can count the weekends because that's just as far as like once you've passed the 7th day of that month and you have, you know, you have to give that carrier 18 days to, you know, get your processed. And so I think that business days and all that would matter on the premium payment portion, but we'll try to flesh this out a little bit more and get back to you as well.
Sure, because I know that when the carrier doesn't get payment, often by say the 10th day of the month, then they won't pay claims. They may suspend claims even. I've seen carriers do that. And I know that the people who are currently operating in this mode are frustrated because the carriers give them such a short window, because they're not going to spend their money paying claims for premiums they've yet to receive or clear through the clearinghouse. So those are some things you may want to just ask to get clarity from the carrier, because the carrier, they will definitely be very firm about it.
Right, and I think carriers provide a grace period. I know that that's been a topic of discussion, Johanna, on the individual side. So we can probably.
Yeah, that's what I was about to say. The carriers, they do provide a grace period, though. They just don't cancel you all off real quick, fast, in a hurry. They do provide a grace period.
And for the timelines illustrated here, we're working towards premium payment 12 to 30 days prior to effective date. So these are contemplating that payment happens before the effective date.
Right. Any other comments on this?
Mimi, this is Wande.
Yeah.
With regard to existing clients, people who have individual account on Maryland Health Connection, and their employer now offers a group policy, can they use the same account they have on the individual market to go and enroll with the group, or they have to go ahead and just create an entire account to do that? So that's the first question I have. If they have to use the existing account, Maryland Health Connection decided early on to do both Medicaid and QHP on the same portal for, and we always encountered this. I don't know how that will play out, how that will impact it. And I think that we need to think about that, how the Medicaid, because we have mixed family, and the husband and the wife are in QHP, and the children are in Medicaid or MCHIP or things like that. So I don't know how, because the renewal, one thing really, the challenge arises because the QHP and Medicaid is mixed, and that I don't know how, when we added this now employer stuff, will play out. I think we have to think about that, think through all of that process.
Mm-hmm. Well, initially we were thinking was that it would be a separate username and login for the employee. Even if they have an account on the MHC for individual, they'll just create a whole new login, and they'll be, because it's different platforms. But we can present this to the IT and see if we can hopefully integrate the accounts and let them be able to use one account to be able to access their different profiles. That's what you're asking, right? Being able to access Medicaid if they need to, and being able to and just using one platform
Yeah,
for that?
I'm asking only the question, what is the total process that's going on? Like, is it creating a different account or using the existing? Because in DC, when the employer offers you insurance, that every employee go ahead and create their own individual account, and then you have access code from your employer, you connect it that way. But you don't do Medicaid at the same time, so it's clear it's only QHP. So with regard to Medicaid, I don't know, maybe other people in this meeting who have we should think about this. I think that's the question I'm saying.
Yeah, I'll just jump in as well to sort of repeat what Mimi said, which is I think we're contemplating separate accounts. I think there's a lot of challenges that come into potentially integrating those accounts across the two platforms, but I also take the administrative simplicity point that if you've entered your information on the individual side, it's painful to have to re-enter it on the small business side. So we can definitely think through opportunities to simplify that. That might be something that we would pursue as kind of a future goal, perhaps not with our initial implementation here for 2025, but great point.
Yeah, one of the things that we've all been taught to avoid duplicate accounts almost at all costs, right? So I would tend to think, and as you mentioned before, it may be a second issue that we may take up later on, but I would tend to think from an IT perspective that there should be like a switch that says, I'm in Medicaid now, or and I'm now going to the group. I'm switching into the group side, still have the same username, password. I'm now with the employer. Now I'm no longer with the employer. I'm going back into individual coverage or Medicaid coverage. I mean, it seems like if we could have a one account, one identity, so that we can prevent duplications, that might be a best of breed as far as, or best practices in the long haul.
Well noted. Thank you both. Ted has his hand up as well.
Yeah, I just wanted to kind of make a comment or an observation. I know there's been some mention about integrating this small business platform with the individual accounts and being able to have interfacing between the two. But the one thing that I would, I guess, caution against is something that in military terms we call mission creep, because right now the small business platform is really cumbersome to use. I think it's a deterrent to a lot of businesses and brokers. They really avoid using it because of the challenges with it. And if we're trying to build a new platform that creates a more efficient process, I think it's best to probably focus on getting a good platform focused on the small business type cases and group plans, and build that first. And then all these other things, if you add more complexity to it now, it's going to be a much longer drawn out process. I think if we just focus on the small group aspect of it, and getting a much higher level of functionality and efficiency, it'll attract more brokers and employers to use it. And then the other things we can, something I think Johanna you mentioned, maybe build that out later on, bring it in as an add-on, kind of like what's been happening with the Maryland Health Connection. I mean, when that platform first started, it didn't have anywhere near the functionality it has now. So it's been a process of improvements, and it's been, it's every year I've noticed more and more improvements. So I think, I would just say stay focused on some core goals for the small business platform, just to get some more functionality and more efficiency so that it attracts more users, and then everything else can be added at a later date. Thanks.
Thank you. All very good points. Thank you. So we can move on because we're at 2:15 and we're only on the slide 18. So employee waiting period regulations. We have the state and federal recommendation or regulation that have general rules stating that a small group can implement a waiting period up to 90 days. And having an employee wait 90 days before their coverage can start presents a moral challenge for me. I mean, I think personally, I do agree with that. And so many employees are left without coverage until they meet that 90-day waiting period. And that also exposes them to continuing their COBRA plan from a previous employer, which might be a little, expensive for them, especially if they haven't connected with individual plans. And so, if they're also receiving income from the employer, it's unlikely that they would be eligible for subsidies on the individual exchange anyway. So, it would be a couple months before they meet their eligibility before they can enroll in the employer's plan. And so this is the federal and state regulations that state that provide our guidance. And then we have these bulleted lists of what we allow for employers to select on the paper forms right now. So they can say that an employee can start the plan on the date of hire, first day of the month following the date of hire, first day of the month following 30 days after the date of hire, first day of the month following 60 days after the date of hire, and on the 90 day after the date of hire. They can also waive the waiting periods for rehires. They can waive waiting period for present employees. And so I'm just proposing here now that on the date of hire, and coverage will begin on the 90th day after the date of hire, will be that we should remove those two options. And I propose that on the date of hire should be removed because it's very hard for the carrier to implement that. So, Sophie, I just saw that your hand was up first, so go ahead.
Yeah, I just have a couple of comments. So obviously, date of hire and 90th day, to have those reconsidered, in the sense that if you don't want those mid-month enrollments, those prorated premiums, waiving the waiting period for the rehires is also going to open up the issue of mid-month enrollments and prorated premiums. Also, we do have groups with both date of hire and the 90th day, more so date of hire, especially groups with a dual waiting period, where a group wants a manager or a professional employee to be added to those benefits immediately. So I think that date of hire, removing that may cause a couple of issues.
I concur.
Okay.
Well, the DC Health Link system, they already removed the data hire because of that issue with premiums and stuff like that. And it's kind of complicated when you do the data hire as well. So personally, I think we should remove the data hire and the 90 day, because the 90 day is too long for people to wait for insurance.
So
I think we should keep the data hire only because there are a lot of professional organizations that's how they get the people in. They have them on the date of hire, and then what they do is the carrier will retroactively bill that employer for the retroactive date of hire.
What about the 90 day?
The 90th day, I think it should get rid of altogether. It's too long.
Okay. Ted.
Yeah, so I'm just thinking, so the Maryland Health Connection right now basically has a first of the month effective date and the end of the month termination date for all plans. So, I mean, I understand with some group plans you have a date of hire option, but because the cycle for the Maryland Health Connection, and I think most plans, I don't do a whole lot of small group, but from what I've seen, typically it's one of the other options, the first day of the month following or 30 days. Rarely do I see data hire, and then staying consistent with what the cycle is for the individual plans. First of the month or end of the month kind of a thing. I would say remove the data hire as well as the 90 day.
Okay, Sally? Thank you, Tyson.
Yeah, I was just going to chime in on the topic as well. So obviously on the individual side, we know if they are leaving coverage and they don't have to take the COBRA, they can certainly hop in anytime, including up to those 90 days with or without a tax credit, until that legal, whatever that employer has decided is this when your benefits are going to be offered. A lot of times that is when the employers are deciding how are things going to go. And I tell people, hey, don't cancel what you have or hang in there until you have perhaps in a probationary period still have it. So I like to leave it with the employer to have all the options, even though we can all make a case. I think the bigger problem is you have a new hire, they don't have coverage currently, and certainly no one wants to see them go, for several months without it. And that is the problem with a lot of small employers when they're hiring someone new that doesn't have anything and they're trying to use us because they don't have a group plan. And we have to let them know, hey, you have to have a legal reason in that individual market to be allowed to hop into that, which might be fine if they moved from another state, etc. But that is sort of just the way those things go. So I like to keep all the options open personally for them.
Okay, thank you for your feedback on that. Anybody else want to add their comments on this?
So I'm just curious to know, none of my employees have ever used a date of hire. And so if we have a date of hire, say for example, an employee gets hired, they start on the 15th or 18th of the month or what have you because of a certain reason, and they have coverage, are they going to be able to see a provider without a card? Are they going to get a card overnight in the mail? Does that cause frustration from an administrative side? Anyone have any experience with that?
I've seen temporary ID cards issued prior to the actual card issue. I've seen
Yeah,
that
I agree.
Especially in group.
Yeah, I agree with Eugene. When we do an enrollment on a small group, most of the time you get a temporary ID card generated right there and then to give to the employee if they've got that date of hire waiting period.
And also it's assuming that the employee has done the employer has done the enrollment for the employee before their date of hire. They have to go ahead and do that in the system. And if they haven't, it's a retroactive enrollment for them. So, and I know the carriers get really frustrated with that, but this has been a good discussion. So if you all want to, discuss this a little bit more later, that's fine. And we can, continue the discussion over email or something. So moving on, minimum participation requirements. So in today's environment, when you enroll a group, the carriers check if participation requirements are met. There are two NPRs, and there are two NPRs right now, on exchange and off exchange. So the employee choice under MHC for small business has a set 75% NPR. And then the off exchange requirement, which is what's applicable to employer choice, even for on exchange, varies by the carriers and so the only carrier that has a different participation requirement is CareFirst. It's at 75%. Everyone else is at 60%.
Of course.
Yes, I know. And so we propose that at least for on exchange, this is strictly for on exchange, for both employee choice and employer choice, we want to propose a uniform NPR set to 60%. Does everyone agree with this? Hopefully, I think most brokers would agree to this. All right, looks like we're getting thumbs up. We're good on this. So special enrollment periods, we sent out a comprehensive SCP list. Our policy analyst, Amelia's really put together and worked really hard on that, citing all of the federal and state regulations, where they come from. And so this is a comprehensive list of everything that we allow right now as far as SCPs within small group. And so hopefully you've had a chance to review all of this. And if based on the list that was provided and this bulleted list, if you would like to discuss anything, you know, that we may have left off or we have added and you would think that it doesn't belong, and let us know. This is the time. Looks like we're good on this as well then.
Quick question.
Yeah.
So what about the in the small group or any group for that matter, the primary employee ages out into Medicare, but he has his dependents on his program, and so now this is an aged out situation because that employee aged out to Medicare, but the dependents still need the coverage, but the group and the employee is still willing to pay for his dependents. But I see that sometimes is this error that comes up every now and then where because the primary person has aged out, they cancel the dependents in the process.
So wait, I think the way this works right now is really when you've aged out, when you turn 65 and you get Medicare, at that, I think people get Medicare after they stopped working. At that point, they would be getting off their employer's plan. But
they're still working.
They're still working.
Yeah, these people, they don't leave. They still work. They turn 65. It's a group that has less than 20 employees. So it happens that they have to get the Medicare coverage, but they had their dependents on there. So what happens is that I have to go to the carrier and have this handled specially all the time because they weren't trying to terminate the dependents. It's just that it was a small group. They aged out. I mean, they aged out into Medicare, but sometimes they cancel the dependents when the employer had no intention of canceling the dependents, and they're paying for the dependents.
Okay, I will respond to that, but Sally has her hands raised, so.
I was just going to comment, just if they want to piggyback off what they do on the under 65 market, the under 65 market has the capability when that mom or dad move on, or one single parent per se moves into Medicare, the system will then still send the data over to just update the account to include the others to continue. So the technology is there if they're going to build the system and the platform that they could look into the individual system to parlay that over to that group platform they're working on.
Yeah, and that's why I mentioned that when I was looking at the special enrollment periods. That was one I didn't see, so because that does happen, what she just mentioned.
Okay, I'm just writing that down, and I will we'll look into that as well and adding that.
Yeah, I don't know that that's technically a kind of legal special enrollment period. Those individuals are already enrolled, but it is about maintaining their coverage. And it's a very good point that that scenario occurs and we need to be able to accommodate it. So we'll definitely keep that in mind.
All right, so eligibility child coverage. So our current policy allows children to stay on the parent's plan until the end of the year after they turn 26. So employers will be able to select whether they'd allow children who turn 26 to stay on the employee's plan until the end of the month after they turn 26 or until the end of the year. We can give both options, but we wanted to gauge the group's feedback on that.
I like both options.
Sally, go ahead.
Yeah, okay. I was just going to say, just want to make sure he had his comment first. I think, generally speaking, that most folks do allow them to stay to the end of the year, and it's pretty customary in that group market that they do get to stay to the end of the year, sort of as that extra courtesy. But that's just, just a thought. Always better to have options. So if they had a burning desire, I'm not against it, but I think it's more commonplace to have it to the end of the year.
Very good. Thank you. Anyone else? All right. Okay, so moving on. the benefit package selection. So the employer benefit package selection will have two lanes. The employer will select either employee choice model or an employer choice model. Then plans will populate based on the model selected. If the employer selects employer choice, they can select one carrier and offer either one single plan or multiple plans. If multiple plans are selected, the employer can select one reference plan. And that would be the base for the contribution levels. Selecting a reference plan is an option that makes the payroll deductions simpler for the employer, but the group can also opt to pay a flat 50% or more on all plans offered. For employee choice, a reference plan is again highly recommended because this model allows the employer to select up to 2 consecutive metal tiers and offer all available carriers. And that's 4 carriers on the small group market right now. So if the group selects gold and silver, we have anywhere from 20 to 40 plans that will become available to the employees. With the selection of a reference plan to base the contribution levels, the brokers will then help employees select the plan that meets their individual needs. Any comments on this? This is an existing benefits selection that we have, so it's nothing, we're not reinventing the wheel here on this one. All right, employer contribution. So this goes back to the reference plan selection to determine the contribution levels. So the contribution levels must be 50% or more on exchange. And so we will allow a reference plan selection with a fixed percentage of 50% or more. Or under the standard fixed percentage, we'll allow a contribution percentage of 50% or more on all plans offered. Any comments on this? We haven't, although we do provide this as a reference material right now, we are not able to implement it in our current system because there's just really no platform for it. But we do try to educate brokers and businesses about this right now. Okay, we can go on. Employer billing. Here we have the billing system that we plan to procure a billing and premium aggregation vendor where the CPA will calculate and collect individual premium payments. So the member level rating is where each covered member's premium is determined according to the premium rate assigned to their specific age group. And then composite premium billing, you all probably have been very familiar with both of these. And so the average premium rate for the group is calculated and then applied uniformly to all individuals within the group, providing a single rate for each employee, regardless of their age. And so under composite rate, you need a minimum of 2 enrolled employees to select this billing method. Okay, we can move on this, or do we need to stay on this one for a while? All right, let's keep going. So our plan to collaborate with this TPA, again, we've kind of been touching on this here and there, but we intend to secure a seasoned TPA for the billing and aggregation services in order to simplify the billing process. So as you can imagine, collecting invoices from 4 different carriers, if a group chooses this employee model, could present challenges. So it's important that the selected TPA can handle this process to ensure employers are not deterred by this complex system, but instead can embrace our efforts to provide an easy to use and user-friendly platform to secure coverage for their employees. And so this TPA will aggregate all of the enrolled members' premiums for the group and remit that total premium payment to the respective carriers or carriers. Under employee choice, that would mean this TPA would be collecting the correct amount from the group and then distributing it across the for issuers that we have available if that's necessary. And then, so any questions on this? All right. So COBRA plans. Our state regulations require employers to provide continuation of coverage for terminated employees, providing up to 45 days to elect coverage. And that would last for up to 18 months. And for dependents, it's up to 18 months of COBRA coverage with the possibility of an extension up to 36 months for special qualifying events. And so typically on the off-exchange market, TPAs provide the COBRA administration services for a small fee, but our system, and this slide kind of covers that, our system will be configured to provide notice to the employees and of their COBRA eligibilities, to offer cheaper plans on the individual exchange, as Eugene mentioned much early on, and allow employees to allow to up to 45 days to elect to enroll in COBRA plans. And so we will partner with the TPA vendor to bill and collect from the employee directly upon COBRA plan effectuation. And I wanted to gauge your opinion on that approach of allowing our TPA to collect that COBRA payment from the employees, the terminated employees. Sophie.
Hi, yeah, sorry, my comment's not in relation to your question. I just wanted to mention that COBRA regs actually allow employees 60 days to elect COBRA, and then they have 45 days to make that payment.
Oh, they allow 60 days now?
Correct.
Okay, I'm sorry. I will correct that. I wonder, because I think I looked at Maryland regs and I saw 45 days, but I will confirm. But thank you for pointing that out. Anyone else? All right, we can move on. Renewals. So the group will be notified and set to a default auto renewal after their initial benefit package selection. They will also have the option to opt out of auto renewal. For groups opting out of auto renewal, if the group has no active enrollments, the plan will terminate at the end of the benefit year. If they have active enrollments, the employer and broker will get reminders to renew or modify the current plan benefit package. And then for groups who are in auto renewal, the benefit package will terminate at the end of the plan year if they don't have any active enrollments. Any questions here? Wow, you guys suddenly got quiet on me. Okay, waivers. We have this list of all acceptable waivers we're currently allowing, and plan to configure this into our portal. So any suggestions, comments about this? This here, Sophie.
Yeah, so to my knowledge, CareFirst do not accept individual coverage as a valid waiver. Not sure whether that's something that can be addressed.
Well, they should be accepting that for on-exchange groups because that is within our regulations. But this system will transmit the information to them, and they cannot deny coverage. Carriers should not be denying coverage for that purpose, but off exchange, that's their prerogative, but on exchange, they should be accepting those.
Okay.
Maybe that's another reason to put your groups on exchange then. All right, let's keep going. Help and support. So we have these forms of help and support for employers. We have brokers, our top, way that we plan to connect businesses with brokers to get them coverage. And then We have Ask Flora. I've asked IT if we can implement that because Ask Flora is on the individual exchange. It's just an AI service or virtual assistant service that you can do a live chat with an agent. And then we have our call center support with dedicated 800 number for employers and employees.
And just
that's
to clarify, this is planned, not current.
later. Yes. So don't call that 1-800 number asking about small business right now. We're not there yet. Required documentation. We're almost at the end here. So most of you are very familiar with this. If you're active in the small group market, the quarterly wage and tax statement is the only document you really need right now to prove the employees exist within that group and that there's a legitimate business applying for coverage. And so aside from these forms, what
question.
Yeah.
There are a lot of companies that don't have the wage and tax statement because they haven't had the employee long enough to generate a quarterly wage and tax statement.
Right.
So the W-4, right, it's the only thing to have.
Mm-hmm.
In that
and
situation.
the W-4 would be fine in addition to other documents, but we're moving away from collecting the documents. We will have a feature that would allow them to upload a document if necessary, but as a backup. But that's where I was going with this next slide, is that the attestation of the small business as they're an established business in Maryland, like their self-attestation should be enough. And then we plan to coordinate with government agencies such as the Department of Labor or the MDAT if necessary to verify the information on the employer's application for new coverage, to verify their employees or the business name and tax ID and all of that. All right. Very good. So we've already kind of went through these discussion questions, but I just wanted to put them back here in case anyone wanted to, revisit anything we've discussed.
I had a question about COBRA.
Yes.
So if an employee has COBRA and they want to go to the exchange because they feel that COBRA is too expensive, but they do it within the 60-day timely period, they can do that, can they not?
They can go to the individual exchange, yes.
In other words, as long as they do it within that 60-day window of
And
losing
they
it.
haven't paid too. They can't pay for it. Once they pay for it, it's a committed contract. As long as they haven't paid, they can basically float the COBRA on any time during that time. They can hop off and go to individual.
Okay, that's what I want to be sure of. Okay, thanks.
All right. So what we'll do next is head into our public comments. And so we'll just give a couple minutes for that. Oh, Sally, yes.
So this is in regards to individual market. I presume we're in general discussion now. Is that correct?
Right now, yeah, we're opening it up for general discussions. Yes.
So this is more of a say workflow question comment. So I have brought up to the Maryland Health Benefit Exchange months ago, I'm sure as many brokers have, Care First, as one of the largest carrier in the individual market, changed basically their workflow of how they're responding to brokers. So previous to, I think it was January 26th is when they turned off their broker phone line. And they said, hey, from now on, the only way you can contact us is you can, most people work with a TPA, a benefit model, Kelly, whatever. You can send your emailed request, fax request, however your TPA is asking to get questions answered. Most of those folks provide us with a weekly book of business, so you can gather some data that way. But the issue is they are the largest carrier, and I am finding that I cannot provide the service I like to provide to my consumers for urgent issues, something to do with billing, dependents that are left off. I need a real-time response. The bigger issue is, okay, maybe I can't do it, but surely they would let someone at that TPA level have that special hotline for that hot potato. And I am being told they do not. All the other carriers, and I won't know, Aetna certainly has it in the group market. Presumably they will have that again in the individual. We represented Aetna many, many years ago before they left they didn't join the ACA market. And I'm trying to gather some information from Aetna as best I can currently on my own. But right now you can Kaiser, even United Healthcare, you can call them, you can email them. They have chat lines. They're very, they're in the technological world where we can get, to a human one way or the other to get a problem resolved. And I know other meetings I've been in, we have requested meetings with Care First. The TPA's request, has Care First. And now we are, in August, and we still don't have a meeting. We still do not have a formal response for Care First. By the way, if you represent Care First in the Medicare market, which I do, guess what? You have a broker hotline. You can email people, you can call people. So I don't know if anybody else has brought that up to you guys other than myself, but it worries me going into the open enrollment session where I personally do check all of my accounts. I think that's really going to hurt service with folks that would like to keep Care First and are expecting, myself particularly, to give them that, extra TLC and red carpet treatment. It's going to create a lot of problems.
Can I just ask if this is an issue for your individual line of business, or is it?
Yes, we are speaking to individual. They're sort of putting us off with the service of the individual. What's happening is, as you can imagine, it's created a backlog. So if I have to send an email request over, the TPA then takes that information. I'm not asking for something I can find out on my own. I'm not that person. I've already checked the book of business log. I've called the Health Connection. I need Care First to step in. And I think most of us seasoned brokers are well aware of what they can legally do, disclose, how their workflow, had internally, been working with us. So we know what they need to do to resolve it. What happens is it goes over, the TPA then has to put that on either an escalation log or an email over. They're getting sometimes 5 days at earliest for a turnaround time, which again, a customer has a very immediate need. There's no way to do it. We've all gotten creative. Some of us have said, hey, customer, let's go ahead and do a 3-word call to the customer service line of Care First, which again is problematic, long wait times. A lot of those folks are not seasoned folks who are giving the best data to the customers where we know what they can do and can't do. And then you try to get a supervisor involved. I would think it's probably, and I've mentioned this, probably creating more calls into the Health Connection or more escalations of us, which is probably slowing down your escalation turnaround, which unfortunately is hitting with all the folks we're helping with Medicaid. So I know there's been some emails going back and forth, hey, escalations are up due to the Medicaid ending, and perhaps not everyone understanding how to handle that. So it's a huge concern for me. I try to do things early, not knowing what we're going to have to do. And it's going to affect the customer base. I think that's going to create a lot more havoc because we aren't in open enrollment. And if I can't get something for over 14 days as an average from them, I don't see how that's going to bode well at time. And again, they have been totally unresponsive about what are they going to do? Are they going to fix it? Or are they just saying, oh, well, too bad, we're not going to respond? I mean, that's just not consumer focused like we like to be.
And Sally, I can jump in. Thank you guys. Thank you for raising that. I see we are getting a lot of concurrence from other brokers in the chat here. My team does kind of meet weekly with Care First, so we will raise this with them and follow up with this group regarding the outcome of that conversation. I certainly agree. We want you guys to have good customer service from them. We don't want things to end up on our plate as escalations because they weren't able to be resolved directly. So I wasn't aware kind of that this was going on. So thank you, and we'll reach out to first about
Johanna,
it.
we did actually have a brief conversation about it, and I joined one of the Care First
touch point calls. This was back in May when Sally first brought this up. And I joined the subsequent call with Care First, which I believe was May 30th. And they were taking it back and were supposed to get back with us at that point. So if that helps you to chase it back,
Thanks.
we did raise it.
Thank you, Rita. Okay, that's great to know.
You know, it seems that with ACA products, with certain carriers, there seems to be somewhat of a bias against it. And it also seems to be a training issue because a lot of people are not well trained, and unfortunately inside the carrier, not well trained about the ACA rules and regulations, how it works. Because the point that she's raising is the point I'm also raising, that I see it happen too frequently, and I have to call inside people since I retired from Care First. I have to call inside the Inner Sancta somewhere to find somebody in the wheels somewhere to say, hey, can you help me with this? And then someone will help me because they know me from way back when, but it shouldn't be that way. You know, it should be something that they have got to take a higher level of concern with ACA, whether it's the individual market or the group market. I don't see the emphasis with it, and because the emphasis doesn't seem to be there, it carries all through, even with your commission payments. You know, so this is a line that I think that they need to find a way to give it a great more focus all the way across the board, whether it's the individual market or the small group market. They've got to find a way to step up the service in that regard, because, like as she was saying earlier, I had people where they were at the pharmacy and the drugs were being denied, and the lady needed the pharmacy to live. And I had to call inside people and go up to the high levels and all kinds of mountains and valleys and things. I finally got to the right person. They finally got the person the medication, but the lady would have died that weekend if she didn't get that medication. It gets to be that serious.
Yeah, I was just going to comment. I totally agree. Due to the, and obviously it was perfect, Eugene, because you actually work for Care First, so you have a better list than I have. But
yeah,
I'm reaching out, saying, calling in favors, like, hey, could you do this, or is there any way can you get this done? And that's great if you have that resource. But a lot of
it shouldn't be like that. That was my whole point.
It should not be that way. And they are not well trained in the ACA. I do agree. It's sort of the stepchild. They would much prefer us to write direct. Most of what I write now is through the Maryland Health Connection because I get access. I have a great portal. You guys have done a great job of listening to what our needs are, giving us the flexibility of what we can do to assist our clients, just knowing what's going on. But their standard line is, and I'm going to speak more to the individual side of the house here, is, you have to call the Health Connection. That's what it doesn't matter what the reason is. They'll call the Health Connection. I'll say, well, wait a second, you have their money. And I have had them overturn when I was able to reach a representative and say, I've got the paper trail. You held their money. You had it in the time. Legally, you're the one who has to fix it. And they have. And I don't ask them unless I am sure it is within their realm of what they can fix. Now, can't do that. I have to go back and say, look, I need an audit done. I need an escalation for an audit, which takes longer, which something that could have been resolved very quickly, getting it in. I really don't know what they have done to their folks. A lot of the folks, when I do call that Medicare helpline for the supplement, I'm like, oh, so this is where you are. Like, I don't know who, it's like, I don't know where they are. I don't know if they went to customer service. I don't believe they were let go, but they really need to have that level of support because as brokers, we are pre-screening these requests. We're not calling for willy-nilly things. These are pre-screened situations that need immediate attention. And it's just unimaginable that they did this January 26th and we're how many months out with several people asking at several levels and we have nothing concrete for them. It shouldn't take that long to figure out what to do or how to resolve it, or to even just turn something back on or get a dedicated team for, the top 5 critical things, like someone's going to die if they don't get their medicine. And yeah, we're going to let you talk to someone. So just wanted to really reiterate that, how important it is that they be held accountable for not giving that access.
Thank you all for that. Very comprehensive and, you know, detailed information about that. So Johanna, I think we all know what to do next. But for our next meeting, although John recommended that we meet, you know, we not meet during open enrollment, we can skip that. But we'll put that in the survey along with like the co-chair voting and the approval of the charter if you want to skip the next meeting. But I did want to kind of gauge the group about what do you want to hear about for the next conversation? What types of, you know, discussions are you interested in? We do have some follow-up items that we've taken back from your comments, but anything new that you'd like us to address or hear about, and on any of our programs here?
I do want to mention one of the things for MHC so that you guys understand that many of us who are covering more than one state. I have to say, I'm going to give kudos to MHC because out of the 20 states that I work with, 5 exchange programs, I think MHC is the best program in the country. Because I think you guys are very conscientious, diligent, concerned, and want to do the right things. And I applaud you guys for doing that. And I'm not just saying that to pat you on the back. I'm just letting you know that I won't mention all the other states that have exchange programs that have not been up to snuff, so to speak. But I think that just reaching you guys has made a big difference. Is why I continue to work with you guys, because I know you guys care. It really matters. And you guys take the time to understand the subject matter. In our society, and it seems that our society, we're tweeting today, but we're not reading. You know, we're not really doing any critical thinking about anything, it seems. But you guys still do some critical thinking. And I think that's kind of like what we're missing. And then the other thing about the carrier issue, not only is it a training issue, but the people that they have working are simply overwhelmed. They have too many cases. I've talked to a lot of these people that do the renewals, and they got 2,000 groups. They can't even keep it straight, much less understand what it is they're supposed to be doing. So it's both a training issue, it's a resource issue, it's a variety of things that I think that we all kind of find a way to work together on this to solve it, because it's not so much pointing fingers as it is we need to resolve it, because we need to resolve it for our society and for our organization and for our industry. And that's really what I'm after.
Thank you for the compliments and for the feedback, Eugene. And then I do see Sally and Wande's hands up. We have 1 minute, but hey, feel free to stay on and, you know, keep chatting. But Sally.
Just really briefly, again, I do concur. You guys really are very helpful, and we appreciate being appreciated. I know when I, usually most of the time it might be a reader or someone responding to me. It's very quick. They understand if I'm asking something, it's important. I appreciate having the very promptness of it and doing that. In regards to the meetings, I do actually work 7 days a week. I can't speak for everyone else during open enrollment, but we really do offer appointments 7 days a week. We're crazy busy. I would love to see perhaps maybe a brief, maybe a shorter follow-up meeting right before we kick off, maybe sometime once we get some more data. I think Aetna's the sort of the unknown. I don't know exactly what products are coming, you know, commissions, et cetera, how that's going to parlay. I think we could possibly see a lot of movement with a lot more work, having a carrier that historically has had a very good, you know, reputation for both, you know, service and network. And also to see, do we have any follow-ups from Care First or what they're going to do? And is there a way? Again, we're not throwing them under the bus. We love their contracts. They really have the best contract, in my opinion, currently, or most cases. But I do agree. I think some of it is just overwhelming of their staff for staffing, but we also have to do our job. So we have to work together. That's all we've asked for is, hey, can we both come to the table and can we help each other? What can we do to ultimately service our client? And that's what we haven't been given. The table is not set yet for us to do that.
Thank you for that feedback, Sally. Wande.
Yeah, so I know we're over time, but I just want to say 2 things. First, with regard to Care First, we don't have any person to contact work with. Even with those of us who have hundreds of clients with Care First and want to service these clients, want to help them, we have no way of reaching out someone. So yeah, definitely will help if they at least set some kind of threshold. If you have 100 clients or 200, whatever amount of clients, that way they don't have to deal with a lot of brokers who have only 10, 5 clients. I understand that side. So if they can at least help some brokers who are committed and have a lot of book of business, that will be helpful. The other thing we didn't talk about, the preferred broker partner program. I believe that's a very important thing to talk about, how that will be implemented, what it is, and what we're going to get next time. I know time is up for this one, but if you can put it in your agenda for next time. Thank you.
Thank you, Juan David. Thank you so much. Carl.
Oh, hello, everyone. That's why I seen Care First coming a long time ago. I seen that one coming, but so that's why I always say that's why you need to have relationships. See, one thing about the Care First, I've seen the going straight to email. See, I have a person I can email directly, and she give me the responses back within a time frame. So that's why I always say, please work on your relationships as well, so that you won't have to go through what everybody is saying that they are going through right now. I have like 3 or 4 people plus. I ain't gonna lie. I used to work for Care First too, so I do know quite a few people over there. So including Eugene, but no, just try to work on your relationships and try to just get through this, and you'll have a wonderful time, because I had a lot of issues just like everybody else is having on here, but those relationships with Care First will help you out. That's all I gotta say. Thank you.
That's a good point, Carl. Did you also used to work at Care First?
You sure did.
Yes, I did.
That helps.
12 years, so I still know the supervisors over there. So
yeah. Okay, good. Well, this has been very productive. I really appreciate everyone's time. And we'll keep in touch over email, and we'll hopefully see you whenever the next one is going to be when we decide that. All right, so have a great day. I'm going to stop the recording and we can all just start dropping off then.